Good morning, everyone. My name is Brian. I want to thank Crosspoint Church here in Clearwater, Florida for letting me use their room today. Their web address is www.crosspointefl.com. Today we're going to learn a little bit more about neurological sarcoidosis. Neurosarc is a complication of sarcoid, which is inflammation of neural diagnosis. Occurs in the brain, spinal cord, and other areas of the nervous system. The alternative name is sarcoidosis, nervous system. Causes, incidents, and risk factors. Sarcoid is a long-term and chronic that affects many different parts of the body, any organ, any nervous system. Primarily, it affects the lungs. In a small number of patients, such as myself, I've been blessed, it involves some part of the nervous system. This is called neurosarcoidosis. Neurosarc can affect any part of the nervous system. You can have sudden facial weakness, almost like facial palsy. It commonly involves the nerves and muscles of the 7th cranial nerve of the brain. Any nerve in the skull can be affected, including those in the eye that control taste, smell, or hearing. Condition also affects part of the brain called the hypothalamus, which involved in regulating many of the body functions such as temperature, sleep, and stress responses. Muscle weakness or sensory losses can occur with peripheral nerve involvement. Other areas of the brain, including the pituitary gland at the base of the brain or the spinal cord, may be also involved. Pituitary is about in this area right here. This is our spinal column. Involvement of pituitary can cause change in menstrual cycles for the ladies, excessive tiredness, extreme fatigue. Seems like you never get enough sleep, or little sleep as you get, you're still totally exhausted. Excessive thirst, high urine output. Involvement of the brain or cranial nerves can cause confusion, disorientation, decreased hearing, dementia, delirium. No, I'm not really crazy. I just have sarcoidosis. Sorry, it's not me, not today. Double vision or other vision problems. Facial palsy, which is weakness or drooping. Almost like you see a stroke patient, their face is going to go down, have a crooked smile. Things like that. You can have headaches, severe headaches. Loss of sense of smell, loss of sense of taste, abnormal taste. I have almost like metallic taste. I can only eat and drink a couple of foods that actually taste good to me. Psychiatric disturbances, seizures, speech impairment, fibromyalgia. It's not a complete list, but may affect each person individually. Just like when we get a cold, it will affect each of us in a very separate and individual way. Similar symptoms, but everybody's going to be good or bad. It's going to depend on the person. Involvement of the peripheral nerves. We have abnormal sensations in any body part. Loss of movement of the body. Joint stiffness. Loss of sensation in any body part. Weakness of any body part. Permanent nerve damage. Again, with the peripheral nerves, symptoms are going to vary, dependent upon each and every single person sitting in this room. An exam may show problems with one or more of the nerves. A history of sarcoidosis followed nerve-related symptoms highly suggest neurosarcoidosis. Symptoms can often mimic other diseases. Sarcoidosis is very famous for this. It can include diabetes, hypopituitarism, hypothyroidism, optic neuritis, meningitis, and certain tumors. Blood tests are very helpful in diagnosing conditions as well, such as LP or lumbar puncture. Show signs of inflammation. And the test they run is called ACE, angioconverting enzyme. Blood test, or just stick a big needle in your spinal cord and get some cerebrospinal fluid. It's a fun test. Another excuse me. Another test that you can use is MRI of the brain. They do a mid-sagittal plane examination, and it goes within the hypothalamus, and they look for masses. Nerve biopsy of affected nerve tissue confirms the disorder. There are no known cures for this disorder. Lots of medication, lots of drugs. Treatment is indicated if the symptoms are severe or progressive. The goal of treatment is to reduce the symptoms. For example, steroids, we have prednisone, help reduces inflammation. Sucralate, for all the medications I take, helps coat my stomach. I take about 20 different medications a day. Simvastatin, cholesterol level. Cymbalta, for neuropathy and for my depression. With methotrexate, we have metformin for my diabetes. Valium when we're spazzing out for that day, so we don't lose control, and it's good to help you sleep at night time. Gabapentin, also known, the common everyday name is Neurontin. Fentanyl patch, 25 micrograms a day for me is the low dose they've got. That's for the chronic pain. Elbow brace. When my elbow swells up, wrist brace to help keep my wrist straight at nighttime so my hand doesn't fall asleep. Glucometer, check my diabetes, and my handy dandy tape for nighttime to tape my eyes shut because my eye doesn't close all the way when I sleep. Again, everybody's going to be different. I have inhalers I take because of my pulmonary sarcoid, etc. But with anything, if you have abnormal symptoms, you think you've had any type of these symptoms, including a stroke, call 911, call your doctor. Now there are some support groups out there that are hard to find. You go to sos.org, that's Sarcoid Online sites. There's a lot of references there. You have TOSS, T-O-S-S, which is a Tim's Organization Sarcoid Support. You go to Facebook and just type in TOSS, T-O-S-S, or you can link to me, Brian Ryan 1. You have NORD, National Organization of Rare Diseases. You have National Institute of Health has a lot of referrals. As I said before, some of the cases go away there in 4 to 6 months. A lot of people have relapses after a few months. Other people, it's going to come on and off the rest of their life. Some it's going to be permanently affected and cause permanent disability and in some cases death. One of the most recent people who died of complications of sarcoidosis was Bernie Mac. Call your healthcare provider. As with anything, we have to be happy with our healthcare provider. If they can't give us the answers, you don't think they're treating you good, call someone, find another doctor who you can depend on and who you can trust. That's the most important thing, is have a doctor who understands what's going on with your body. Some doctors, boom, in and out. That's it. Prevention. Treatment of sarcoid turns off the body's immune response. It turns it off. Before your nerves become damaged, you have to seek help. You have to find that doctor who's going to help you. This may reduce the chance of neurological symptoms will occur. But again, my thing is, find the doctor who's going to help. Watch your own body. Know what is going on with yourself. And again, that was my topic for today, neurological sarcoidosis. Again, I want to thank Crosspoint Church here in Clearwater, Florida for letting me use one of their educational rooms. Thank you very much and have a blessed day.